Mr. Chair and members of my favorite committee. I'm excited to discuss and share House Bill 5318 for the second consecutive year. In summary, this legislation would create a comprehensive lead service line replacement program using funds from the Federal Infrastructure Investments and Jobs Act and other federal sources to ensure that all homeowners and renters across Rhode Island have safe, lead-free water in their homes without the worry of any out-of-pocket expenses. So while the use of drinking water in regards to lead pipes was banned over 30 years ago, there is currently no law in place that requires that these contaminated pipes be replaced. Like the rest of New England, our state has old housing stock. Old housing stock that is equipped with lead pipes. And according to a recent study and report from the Rhode Island Infrastructure Bank released roughly 2 years ago, it is the city of Providence, Newport, Warwick, Pawtucket, and Bristol as being some of the communities that have the highest rates of lead service line presence. So administered by the Rhode Island Infrastructure Bank and the Department of Health, this statewide effort would require that they coordinate with local water suppliers to update or create an inventory map that tracks the known presence of lead service lines. The details of this inventory can be found on page 5 and 6, which detail how the inventory would take place and over the course of the timeline. So now, based on the inventory map provided, the Department of Health and the Infrastructure Bank would determine the estimated cost with replacing all of the lead service lines within a water supplier service area. On that note, any water supplier that receives a financial award from the Infrastructure Bank that exceeds $1 million or more in order to execute their lead service line replacement plan would be required to participate in an approved apprenticeship program for all crafts and trades that would be employed on the project at the time of bid, such as pipe fitting. Furthermore, the water supplier would work in conjunction with the Infrastructure Bank to develop a comprehensive plan to replace all identified public and private lead service lines across their respective service areas. As a part of each plan developed, water suppliers would have to prioritize zip codes with the highest concentration of lead water presence and populations who are most sensitive to the presence of lead, such as children. Now, upon identifying and confirming the presence of lead service lines across residential units, the water supplier would be required to provide a written notice to residents, including the property owner and tenants, about the lead presence that was found in their water system. This notice would include lead service line replacement instructions and contact information so the respective residents can start the process of scheduling their lead service line replacements. And it is important to note that this legislation, as required by the federal funds that we would be administering, that the lead service line replacements be free of cost to both the homeowner and or the renter. Additionally, water suppliers would not be allowed to request an increase in residential water rates as a result of receiving grants, loans, or other financial assistance for the purpose of replacing these lead service lines. So in other words, our constituents should not have to worry that the replacement of their lead service lines is going to directly result in higher water rates or a higher water bill going into the next fiscal year. This program would also empower renters to have the right to request and schedule a private side lead replacement with their local supplier. Naturally, water suppliers would be authorized to notify the property owner of the renter's request and begin the process of scheduling a private side replacement. I emphasize this point in particular because generally renters are more likely to live in a home with the presence of lead service lines, especially renters who live in older, dense, multi-family homes. And I will be very blunt. Any lead service line replacement program that does not allow renters to request their own lead service line replacement is unfair and a form of class discrimination because no one's health should be dependent on a property management company or a landlord's irresponsiveness in order to get their lead service lines replaced. Because our goal with this program is to ensure that we are maximizing the funds for all Rhode Islanders to have lead-free water Therefore, the opportunity to request that your lead pipes be replaced should be available to all people, regardless of their socioeconomic status or their living situation. And so to ensure that progress is being made with these funds, following the end of each fiscal year, each water supplier would be required to provide a report to the governor, the General Assembly, the director of the Department of Health, and the executive director of the Rhode Island Infrastructure Bank, detailing the number of public and private lead service lines that have been replaced, an estimated number of service lines still waiting to be replaced, and the annual expense that it will cost to replace the existing lead service lines that are still present. Now, contingent upon the available federal funding, each water supplier would have the goal of trying to replace as many of the identified lead service lines available over the next 10 years in accordance with all federal requirements and any federal updates that come in regards to the guidance we receive. So given that there are over 35,000 existing lead service lines across the state, 26,000 of which are located within the county of Providence, the presence of lead in our drinking water is a public health issue that requires urgent action. And so it is critical that we either pass this legislation or incorporate the language of it into the fiscal year 24 state budget. Because it is important that as we allocate these federal infrastructure funds for lead service line replacements, that we have standards in place as it relates to the coordination between the Department of Health, the Infrastructure Bank, water suppliers, as it relates to the inventory of lead service lines, incorporating an apprenticeship program that would help support the means of labor, protect ratepayers from water supply rate hikes, and empower renters to seek their own lead service line replacements. So as I close, I want to thank all the community organizations, specifically the Childhood Lead Action Project, and the different state agencies, including the Infrastructure Bank and the Department of Health, that contributed to the language and drafting of this bill, because it has been a multi-year effort. And as you will find in your committee documents, the Department of Health has recommended language updates just to ensure that we are in conformance with the new federal guidance, which recently came out. Because given that these federal funds are from the infrastructure bill that was passed last year, the guidance is still being updated on a time-to-time basis. So it's important that we update the language, but also ensure that whatever language we do pass, we include specific provisions saying that the language is adaptable anytime federal regulations regarding the funds changes. Thank you.
Do you know if there's currently any requirement that a landlord disclose to a prospective tenant that there's lead piping in the apartment that the individual is seeking to rent?
So unlike lead paint, when it comes to lead service lines, no, because we don't have a certificate of conformity when it comes to lead service lines. Unfortunately, we have a lot of homeowners themselves who don't even know that they have lead service lines because they haven't gotten it tested for lead. But this bill, however, once a resident, again, whether the homeowner or the tenant, is aware that they have lead service lines, it would require that if it is a rental unit, that the information be disclosed to the tenant. But in terms of current existing law, there is no requirement.
Would you consider adding that to this bill, or do you feel that should be a separate action altogether?
Absolutely. I think, again, the issue is that we don't have the inventory map right now. So I would argue, unfortunately, that it would be unfair if we were to say you have to disclose this information that you don't even have accessible. But as you stated, once we pass this bill, at that point in time, most property owners should be aware whether or not they have lead pipes. And I think that would be important thereafter to say, all right, now that you have that information, you have to disclose it.
Excellent. Thank you. Thank you, Chair.
This is also the Lead Pipe Poison Prevention Act. This is a cooperation between the federal government, Jack Reed, the administration, under the leadership of the governor, and the leadership of the Senate President, and myself. We have talked with numerous water supply boards, like, for example, Providence Water. We have also Infrastructure Bank, and again, the Senate Office of Jack Reed, who is providing the money, the $151 million to pay for this, which means there will be no cost to the state of Rhode Island. And that we had a press conference with Jack Reed, the governor, the Senate President, and myself, and the Providence Water Supply Board, and laborers who, again, was in full support of this bill. And we are working together It is a perfect example of the cooperation between federal government, state government, and local governments. And we have identified, for example, all 892 lead pipe situations in the town of North Providence. So we have already started, the Providence Water Board, to identify what homeowners has lead pipe issues. And I'd like to point out, under the leadership of Jack Reed, his full support of this bill, along with the governor's full support, the League of Cities and Towns throughout the state, and the Senate President and myself, this bill will be passed and we will eliminate this problem in the next 10 years. Thank you.
Hi, Mr. Chairman and members of the committee. My name is Caitlin Rabb. I am a policy analyst at Rhode Island Kids Count. And today I'm here to testify in support of House Bill 5007 and 5318, both the Lead Poisoning Prevention Acts that would establish a plan and guidelines to replace all the lead service lines statewide, really leading to cleaner water and safer drinking water for all Rhode Islanders. I'll give you a little bit of data on why this is important and how this is impacting our kids in our communities. So we know that lead poisoning is really serious and it is entirely preventable. And it affects hundreds of children in Rhode Island every single year. And we know that in addition to, paint in homes, it's also in contaminated soil and in the water. So Rhode Island has showed a lot of leadership on this in the past in terms of getting these rates down. And we've gone from almost half, or 47% of our kids entering kindergarten in 2004 having elevated blood lead levels to now in 2022 only about 5%. So we can see that there's been a decline, but even with that, there are stark disparities between cities and race and ethnicity that are impacting our children of color and our low-income communities at much higher rates. So even these lower rates are an issue, and we need to make sure that we're making getting rid of the lead service lines. So in 2020, 631 of the almost 20,000 Rhode Island children under 6 who were screened had confirmed elevated blood lead levels, and children living in the core cities were almost 3 times as likely to have confirmed elevated levels than the remainder of the state. So we know that there is no safe lead level in children, and even at our low exposures, this can have really irreversible damage and consequences for our youth, for their growth and development and learning. So this is really important to make sure that we get this done. And so these funds will really allow Rhode Island to replace many of the service lines and result in safer drinking water for Rhode Island children and families. And we want to make sure that we get this right and do this equitably and make sure that this investment is thought out with a solid plan. So we are here to offer our support for both House Bill 5007 and 5318.
Hello. Thank you, Chairman Abney, and hello, members of the House Finance Committee. My name is Georgia Wright. I'm a Providence resident and a lifelong Rhode Islander, and I am testifying on behalf of Reclaim Rhode Island in support of bills HB 5318 and HB 5007. Together, these two bills contribute to the Lead Poisoning Prevention Act, reducing childhood lead poisoning in Rhode Island and guaranteeing safe and healthy water for every household should be a top priority of our state government. I was profoundly shocked to learn that lead poisoning is not a phenomenon of years past, but instead a present-day Rhode Island crisis affecting every community in our state. While the use of lead for drinking water pipes was banned over 30 years ago, there is currently no law that requires contaminated pipes to be replaced, which is very shocking to me. The state of Rhode Island currently has 35,000 lead service lines, of which 26,000 are in Providence County. This leads to a disproportionately negative impact on working families, communities of color, and renters. In recent years, an estimated 1 in 14 kindergarten students in our state had been poisoned, and nearly 20% of children in some municipalities tested positive for lead poisoning at least once by the time they left elementary school. New Shoreham and Providence have been especially hard hit, and this poisoning is a preventable tragedy. As a volunteer organizer with Reclaim Rhode Island and Pioneer Tenants United, just this year I have met multiple tenants whose children had elevated levels of lead in their blood due to unsafe drinking water in their homes. In 2020, over 470 children under the age of 6 were diagnosed with lead poisoning, an increase from the year before. The effects of this lead poisoning are long-lasting, as increased blood lead levels are linked to developmental delays, aggressive behavior, and school suspensions. These already struggling families are now facing painful and expensive new difficulties, deepening inequality in our systems and institutions. Would you knowingly let your child, grandchild, or loved one live in a home rife with physically and neurologically damaging toxins? No parent should have to make a trade-off between their child's health and having a roof over their head. Replacing the lead pipes that transport drinking water to hundreds of thousands of families across the state should have happened years ago. Now, with the influx of federal funds, passing these bills doesn't even have to be a debate. People have a right to clean drinking water without which they cannot live. Additionally, tenants and homeowners have a right to know if the property they are rented uses lead service lines. These bills will guarantee a service line inventory on the website of the Department of Health, alongside the online maintenance of a map of lead service lines, so that every resident can track their own safety and their home's progress towards full lead line replacement. This sharing of information empowers our neighbors and community members to put their safety first. I harbor no delusions that replacing lead service lines is an easy ask, but it is a worthwhile and moral one. I strongly believe we can and must meet the 10-year timeline for lead line replacement proposed in Bill 5318. Some big projects are worth undertaking for the health and well-being of the youngest and most vulnerable in our community. For these reasons, again, I support Bill 5318 and 5007, and I urge the committee to pass these crucial pieces of legislation. Thank you for your time.
Thank you, Chair Abney and members of the House Finance Committee. My name is Erica Hammond, and I am the lead organizer with Climate Jobs Rhode Island. We are in proud support of H5005, which creates a plan along with an efficient timeline to replace all lead service lines statewide over the next decade. This is the only way to ensure all Rhode Islanders have access to safer, lead-free drinking water. Climate Jobs Rhode Island is a coalition of more than 30 labor unions and environmental organizations throughout the state, working together to establish a just transition to an equitable, pro-worker, pro-climate, green economy. Since our coalition's inception, we've been working together to simultaneously address climate change, create thousands of good union jobs, and advance racial and economic equity throughout the state. The serious issue of lead in our drinking water cuts directly to the core of the coalition's existence: equity, environment, and jobs. Lead poisoning is a serious health and environmental justice issue with lifelong consequences affecting hundreds of Rhode Island families every year. There are nearly 30,000 remaining service lines made of lead or unknown materials throughout the state, many of which are in frontline and environmental justice communities that tend to be Black, Indigenous, people of color, and low-income communities who continue to experience deep inequities. This legislation will ensure the prompt and efficient removal of all lead service lines, beginning with the communities that need it the most. The complete removal of lead service lines is the most effective way to protect Rhode Island families from lead contamination in drinking water. Additionally, H5007 creates pathways for job creation by requiring labor standards and apprenticeship utilization on projects of scale. A skilled, safely trained workforce is essential to preventing hazardous exposure to workers and communities. While we are in strong support of this legislation as it stands, we do recommend the adoption of language to strengthen these standards. I've included that language in my written testimony as well. And I'd also like to echo comments that you will hear from our colleagues over at the Childhood Lead Action Project regarding the addition of language to strengthen tenant protections, as well as protections against rate hikes, and language to incorporate community engagement and a community outreach and engagement process. Lastly, reliable water infrastructure is essential to developing affordable and safe water. When water infrastructure fails, it threatens people's health, peace of mind, and the environment. And just as everyone deserves the right to a safe and healthy workplace, everyone deserves the right to safe drinking water. Thank you again, Representative O'Brien and the bill sponsors for introducing this important legislation, and thank you to the members of the House Finance Committee for the opportunity to speak on its behalf. I ask that you protect Rhode Island families from the devastating effects of lead in drinking water by supporting House Bill 5007. Thank you.
Thank you very much, Chairman and committee members. My name is David Valise. I am the director of the Rhode Island Interfaith Coalition to Reduce Poverty, a coalition of faith leaders from many faith traditions that are fighting poverty and inequality. I'm also here today as the environmental justice chair of the Sierra Club in Rhode Island. In both those capacities, I am here to support Bill 5007 as well as 5318. Thank you to Rep. Morales and Rep. O'Brien for sponsoring it. Lead poisoning, as was mentioned, I won't go over all of the points because we all have a long night, but it's one of the biggest environmental justice issues in Rhode Island, disproportionately impacting poor communities and communities of color. As an organization that fights poverty, we also highlight the fact that it has long-term effects on children and therefore can perpetuate poverty by lowering school attendance and excelling in academics. We know that myself personally was lead poisoned as a kid, and I can tell you personally that it is no picnic. I also know that if we are, as a coalition of faith leaders that hear all the time that, we hear this concept that God is love, and we always ponder in it. We like to emphasize and pitch to all of you that if God is really love, then we need to start showing that love in action, not only in prayers and thoughts, but in passing policy that really starts putting children and families first, like these two bills do. Thank you for your time.
Thank you. Thank you, Chair Abney, and to the committee members. My name is Deborah Levy. I'm a community organizer at the Childhood Lead Action Project. I'm here today to support Bill 5007 and Bill 5318. I know you already heard a lot about the effects of lead poisoning, so I won't focus so much on that, but I'll tell you about all the work that went into making these bills happen and a little bit about why it's needed and some of the details behind it. In addition to the well-known threat of lead paint in older homes, as you already heard, contaminated water from tens of thousands of remaining lead service lines statewide contribute to hundreds of children being lead poisoned every year. This is an environmental justice issue, like Mr. Valise said, and in fact, we have documented evidence of lead in water being an issue in Providence, as Providence Water, Rhode Island's largest water utility, has tested above the EPA action level for lead in water for 15 out of the last 17 years. And some years that level of lead in water was higher than it was in Flint at the peak of the lead and water crisis. This is happening in our city. Community advocates before me have been trying to sound the alarm about this for years. For decades, we've been working on this issue. But right now, we have a really unique opportunity with the funding coming from the federal government to address this problem. So Rhode Island will be receiving $146 million over the next 5 years from the bipartisan infrastructure bill, specifically for lead pipe replacement. That money is not going to any other water infrastructure projects. It's for lead service lines. This is great. This is huge news. We really need a plan to be able to make sure that money is spent well. And there are people in our community, in our state government, who've been working on this issue for many years and have a lot of ideas about the ways that we can make sure that money doesn't go to waste. The last thing we want to see is to have to give some of that money back to the federal government because we haven't been able to spend it. The most recent data from the health department tell us that there are 35,000 full or partial lead service lines remaining in Rhode Island at an average cost of $5,000 per replacement. These funds will cover about 80% of the cost of the rest of the lead service line replacements in our state, which is a really great start. And there are plenty of other sources, federal grants and other drinking water revolving fund sources that the rest of the funding can come from. So like I said, it's essential that we have a plan in place to spend that money. Our community coalition and our supporters at Childhood Lead Action Project, which we have support from over 40 community organizations, hundreds of individual Rhode Islanders, many state and local legislators as well. We're really excited to see this legislation that sets a timeline for replacements. We want to see those replacements done in a complete way, no partial replacements. We want to see them done at no cost to most residents and property owners, which this legislation guarantees in terms of the replacements that the infrastructure bill will be able to fund. We also want to make sure that residents and property owners are fully informed of the presence of a lead service line at their property, which is another thing covered in this legislation. and the dangers it can present, as well as creating a pathway for job creation as part of lead service line replacement, and giving the Department of Health and the infrastructure bill a little more direction in doing that fundraising to cover the rest of that. We also want to make sure, these bills are great, they could be stronger. We want to make sure there are tenant protections in place in these bills. We want to make sure that renters have the ability to request and schedule a lead service line replacement, because too often those public health decisions are left in the hands of a landlord who may not even live in the property, let alone in the state even. And we also want to make sure that there are protections against raising rates to cover the cost of this project. And it's also really important to have community outreach and education about this project. That money's not going to get spent if people don't know that they can sign up for a lead pipe replacement. So the bills are great. We very much support them. We want to see them be a little bit stronger, and those are the suggestions that we would make. We've reached out to all the sponsors, and we hope to continue to work with the legislature to make them happen. So thank you to Rep. Morales and Rep. O'Brien and to the committee for hearing me today.
On 5318 and 5007, you've heard about the immeasurable human cost of lead poisoning. I'm here to also tell you that there's an amazingly high cost to the health economy and to the healthcare delivery system. Pew Charitable Trust researched the economic cost of not dealing with lead paint and lead removal, lead abatement. And in fact, they found that $1 invested in abatement of lead saves $17 in medical, behavioral health, and special ed costs down the road. So it's an investment that we ask you to make this year to help the children avoid these very high costs, and all of us in higher healthcare premiums down the road. Be happy to answer any questions.